Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health, and I'm here on the territory of the Lekwungen-speaking people, the Songhees and the Esquimalt First Nations. Dr. Bonnie Henry, our provincial health officer, is in Vancouver on the territory of the Musqueam, of the Squamish, of the Tsleil-Waututh, and it's my honor to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. I want to start by acknowledging today that the world is a little bit more uncertain, and for some people that can be provoking anxiety and fear, and particularly with
years with the COVID pandemic and the number of climate disasters that we have been through here in BC. And I know that this weighs on us, and especially on children. And I want to remind people there is help. I want to remind people about the Kids Helpline in particular, 1-800-668-6868, or you can text 686868 and reach out and talk to somebody. These are times when we need to connect with each other and support each other, and especially for our children. Having said that, we are seeing some very encouraging trends that set us well for the path ahead here in British Columbia. In many parts of our province, the transmission of COVID is down, which in turn is relieving the intense pressure that we have had on our hospitals and on the broader healthcare system. At the same time, there are still many areas that have significant transmission, and we are still seeing widespread transmission of this virus across the province, which is why those protections we have in place right now remain a necessary part of our strategy for now. As we move into March, today being March 1st, we have committed to monitoring these, to making sure that we can make the changes that are needed based on our best data and our pandemic. And we've talked about the importance of doing this prior to spring break, and that is something we have committed to, and we'll be looking at additional precautions and if we're in a better place to be able to remove some of additional measures very soon. This morning I had the opportunity to spend some time with immunizers across BC and across parts of Western Canada in the BC Immunization Forum. And it was really an opportunity to reflect on the incredible work of so many people that have gotten us to this point in the pandemic. We've delivered over 11 million doses of vaccines in every corner of British Columbia. And people, immunizers from all walks of life, have been stepping up and doing a tremendous job. And I just want to express my gratitude for the heroic work that they've done across the province and continue to do to support people in making those important decisions. And I want to thank British Columbians for stepping up and getting vaccinated. Some of our newest tools are new types of vaccines, the protein subunit vaccines, Novavax, which we talked a little bit about last week, and a number of questions have come in, so I just want to talk about a number of them. The Novavax vaccine is approved for use for people 18 and above. It has not yet been tested in younger children. It is safe to mix and match, so if you've had an mRNA vaccine or a viral vector vaccine as your first dose, and you've had concerns or side effects from that, you can use this as a dose too. You don't need to start again. So Novavax can be your second dose in the primary series, and it should be at about 8 weeks. It can also be used as a booster dose if you've had 2 doses of any other vaccine. So it is safe to mix and match. There is no need to start again. And for those people who have not yet started your course of vaccination, Novavax is a perfect opportunity for you to rethink that and get the protection that others have. So if anybody is interested in Novavax, you can call 1-833-838-2323 and put yourself on the list. And I know we have close to 1,000 people at least already on that list. And as soon as it comes into the province in the next few days, we'll be making arrangements for you to get your dose. In addition, last week, Health Canada approved the Medicago vaccine, which is a really interesting plant-based vaccine. It uses what we call a virus-like particle that is developed in plants, and again, it provides the entire protein to your immune system. So it's different from the mRNA vaccines, where you get the code for developing that protein, and it is packaged with a similar adjuvant to what we used for the H1N1 influenza vaccine, and it's a similar type of vaccine to the ones we have for HPV and hepatitis. So it is a more one that we're more used to. I will say that it is only approved for use for people 18 to 64. They didn't have a number of older people in the trials. So right now, there's no reason to believe it's not effective in older people, but the data is not there. So it is for people 18 to 64 years of age. Unfortunately, though, we're not expected to receive any of this vaccine in the province or the country for the next few months. I will say vaccination is our key. It's the key that we have had for getting through this past two waves, both Delta and Omicron. It's made a tremendous difference in reducing transmission, and we see that particularly with the booster dose. And yes, the booster dose is effective at preventing you from getting infected with Omicron. We've seen that. It's 60 to 70%. Data from Quebec shows that it's 80% protective on preventing you from needing to go to an emergency department, and we know that it's highly protective at preventing hospitalizations or ICU care. So I am encouraging everybody who has not yet had it to get your booster dose. It will help you now, and it will help you for what we will be dealing with in the future. And I will remind people that in hospital right now, thankfully, we have decreased numbers of people, but 47% of the people in our ICUs are people who don't have that protection that vaccines have been giving us, and that comes from about 8% of the population. You are much, much more likely to get severe illness if you don't have the protection, if you don't have your immune system stimulated by vaccination to recognize this virus when you're exposed to it. And it's still about 20 times more likely that you're going to have a more severe illness. And I know people have sent me notes about the fact that there's more people by numbers in hospital who have had vaccines, but that is because so many of us are now protected through vaccination. And some people, yes, are at most more risked, but your risk is still that much greater if you don't have that protection from your immune system that vaccination gives. And I liken it to the analogy of we all know people who've smoked for long periods of time, and not everybody develops lung cancer, but your risk of smoking and developing lung cancer is much, much higher than a non-smoker. Very similar to what we're seeing with vaccination. As has been the case throughout the pandemic, we all have a role to play, and we need to make decisions based on our personal risk and the risk of those around us. The responsibility of us in public health is to give you the tools and resources to be able to manage and to understand that risk. And as we've seen, as we've gone through this period, we've come to understand a lot more. We know that the most important tool remains protection through immunization, but we also now have more access to things like tests that help you make those decisions about your own health if you develop symptoms. Looking ahead, as we expect transmission to continue to decrease and the weather gets warmer and we get into spring, we spend more time outside, we will likely no longer need those extra layers of protection that we've had in place during this peak of transmission during the last few weeks. Of course, this is not the case for everyone. We know that some people who are immune compromised, people who are older, will need to continue to take a cautious approach. And this is where, again, we need to work together to do what is right for us and to respect that other people have different risk. And that understanding that masking is important for people, everybody right now, but it will continue to be important for a number of people. Keeping that respectful distance, knowing that not everybody will be moving at the same pace. Keeping groups small will remain important for many people. As we are getting close to spring, we know that respiratory season tends to wane, but we know as well that it tends to increase as the winter months come again. So we will have continued uncertainty as we move through the summer. We hopefully will be in a good place for the next few months because of the immunity that we have and where we are, to be able to relieve the pressure that some of these measures are in place. But we need to be prepared for immunity to wane again and for us to have new approaches and adapt depending on what we see come the fall. We have all experienced the impacts of this pandemic, and without a doubt, it has been difficult. That is why we will be removing restrictions and layers of protection as soon as we are confident we can safely make those changes and we can support everybody in doing that. We are being cautious. We have heard loud and clear that we need to be thoughtful and move cautiously and slowly, because that is the way that we will continue to gain ground and not lose it. Each step of the way, we will make the decisions based on what we're seeing, on the data that we're seeing here in our pandemic. At the same time, I am very optimistic that we are moving to a better place rapidly, and we'll have more to say about that very soon. I know things like graduations and performances and concerts and many workplaces are now moving to full in-person return to work, if that hasn't occurred already. We are in a transition period, but we will take it slowly and sustainably as we move into the next little part. This pandemic has also shown us the importance of connection, even virtual connection. And now more than ever, we need to continue to support ourselves, to make sure that we reach out and connect with those in our life right now, people we may not have connected to build those bridges as we move into this transition phase, and to make sure that we continue to support each other with compassion and with love. It is important to know that the things that we do make a difference to everyone in our world, whether we're doing it for those we love and for those we don't know. It is important for us to now, with all of the uncertainty that we're facing, to reach out and connect and support each other as we've been through this storm together. Thank you.
Thank you, Dr. Henry. And today I'm providing an update on rapid test deployment and surgical renewal. But first, I wanted to give a brief update on the impact of sickness on healthcare workers and the healthcare system. Health authorities continue to closely monitor sickness levels across health services, especially in hospitals, long-term care, and home support. I can report that from February 21st to February 27th, 13,631 healthcare workers called in sick. That includes 3,121 in the Fraser Health Authority, 2,517 in Interior Health, 1,299 in Northern Health, 1,293 in the Provincial Health Services Authority. That includes BC Emergency Health Services, our ambulance paramedics, 2,137 in Vancouver Coastal Health, 2,679 in Island Health, and 585 in Providence Healthcare. Just to put that in context, February 21st to 27th, that's 13,631. Last week, February 14th to 20th, 14,579. February 7th to 13th, 15,542. January 31st to February 6th, 17,158. Each week, the number is lower, although it's still above what we would normally expect at this time of year, but it shows the same thing as other indicators that Dr. Henry has referred to, the fact that hospitalizations are half of what they were, less than half of what they were at the peak of the Omicron variant of concern wave. Once again, I want to express gratitude to healthcare workers who continue to lead us through the pandemic for their endurance and their skills. Today is BC Care Providers Day, and healthcare workers, particularly in long-term care and assisted living, are being celebrated today. I encourage everyone to find a way to celebrate those healthcare workers, members of the Hospital Employees Union, the Health Sciences Association, the BCNU, the BCGEU, the Doctors of BC, the Union of Food, the UFCW, Union of Food and Commercial Workers, and others who are significant players in the healthcare system, and all those operating and running our long-term care and assisted living facilities across BC. And now an update on rapid tests. As of February 28th, BC has received 24,056,910 rapid tests. We continue to prepare for the arrival of 12 million tests over the next 4 weeks at a rate of 3 million per week. 17,525,751 have been deployed to key strategic areas. As previously noted, just over 500,000 tests in our inventory are not suitable for deployment or personal use and are being used at the discretion of medical health officers in the appropriate setting. They need a health professional to do the tests. That leaves a current inventory of 5,974,000 tests suitable for self-administered use across the province. To date, 3.3 million tests have been distributed to K-12 schools across the province. 2.1 million tests have been distributed to post-secondary institutions, already distributed. 2.5 million tests have been delivered to more than 900 pharmacies, with more pharmacies receiving deliveries soon. An additional 600,000 tests will be sent to pharmacies this week. As announced those week, these tests are for British Columbians aged 70 and older to pick up a kit containing 5 tests at participating pharmacies. This age group is a priority, as we've said many times, because the evidence indicates they are at more risk of serious consequences if they become infected. If they become symptomatic, the test will allow them to determine if they may have COVID-19, so that other actions can be taken as required. As of yesterday afternoon, end of day, pharmacies have delivered approximately 366,000 tests. That's more than 70,000 seniors 70 and above have received their tests. For more information on accessing test kits, British Columbians can visit bcpharmacy.ca to get the location in their community. It's important to remember that testing continues to be something that we do when we have symptoms. That hasn't changed. Increased test availability means more members of the general population will be able to access tests to use to understand their own symptoms and illness, and to take actions to limit transmission to their friends, family, and work, including and especially those at higher risk. And now finally, here's our weekly surgical renewal update. Health authorities report that 6,428 surgeries were completed from January 30th to February 5th. From February 20th to February 26th, our most recent week, health authorities postponed 99 non-urgent scheduled surgeries. That's 2 in Fraser Health, 92 in Interior Health, 1 in Vancouver Coastal Health, 2 in Northern Health, 2 in the Provincial Health Services Authority. Cumulatively, from September 5th, 2021 to February 26th, 2022, regional surges of COVID and factors including severe weather patterns have caused 8,025 surgical postponements. For several weeks now, with hospitalizations due to COVID high and with a great many patients with COVID in our ICUs, we've talked about our role in bringing those numbers down. We've said our work together, makes the difference that matters. And here's how. This week, all health authorities, that's Fraser Health, Interior Health, Northern Health, Vancouver Coastal Health, Vancouver Island Health, and the Provincial Health Services Authority, all our health authorities began scheduling and completing postponed surgeries, all of them. We've also talked about how each moment matters, as does the difference we make in it. And the difference we've made to patients who wish to proceed with their postponed surgeries by stopping COVID's rapid spread and easing the stress on our hospitals is just as impressive. And here's why. Because 99.8% of patients whose surgeries were postponed in the first wave have had their surgeries. Because 94.2% of patients whose surgery was postponed in waves 2 and 3 have had their surgeries. And because 49.2% of patients whose surgeries were postponed in waves 4 and 5 have now had their surgeries as well. I think it's worthy of pause by all of us to think how welcome this news is for patients across BC, for the families and friends supportive of them, their care and their well-being, and how much it says about everyone involved in delivering surgeries. And in that, it reminds us our work is not done. These achievements demonstrate again all that is possible. of the progress that is ours to make. And here's what I think we need to do now. Take care. As restrictions ease, as we've all been out and about more, we need to take care. Ease into activities we haven't done for a while and make sure we're ready for the change, the demands it places on us, and the attention it requires of us. Take care of, think of those, all of those who deliver our care, make our surgeries possible. Take care and support residents in long-term care and keep our hospitals doing all the remarkable things that they do. Take care of ourselves and each other to ease the workload on them whenever we can. That's the work we need to do now. And with that, we're happy to take your questions.
A reminder to reporters on the line, please press *1 to enter the queue. You will be limited to one question and one follow-up. Our first question today comes from Lisa Cordasco, Vancouver Sun.
Thank you. I'm wondering, as we move into this new phase, what type of surveillance systems will you put in place to, accurately monitor any transmission in the community or to be able to identify variants in the future?
Thank you for that. That's a really great question.
Thank you for that. It's a really great question. I didn't talk about surveillance. We did talk about it a couple of weeks ago, but this is what we're working on with our team, particularly at the BC CDC, but we have a number of different things. We are going to be moving to a weekly report rather than the daily numbers, and hopefully that'll be very soon as well. And what we will be looking at is integrating the surveillance that we're doing for COVID into our serious respiratory illness surveillance that we have all along. So there'll be ongoing testing from sentinel physicians. We've got a way of doing that we do for influenza that will be including COVID. We're looking at expanding the wastewater testing surveillance that we're doing over time and expanding it not just for SARS-CoV-2, but for other pathogens to help us understand what's circulating in communities around the province. We are looking at how do we use regularly, routinely collected blood for other reasons to help us understand if we're seeing an increase in seroprevalence of COVID. So these are all things that we're adapting and modifying what we're doing now as we're in this transition phase. So we'll have more details about that, but it will be looking at how do we make sure we have a way of seeing a snapshot on a periodic basis of what's happening. The other really, really important thing is we are continuing our whole genome sequencing, and the sampling that we're doing and how much we send for whole genome sequencing will vary as we see transmission and amount of virus circulating in the communities decreasing over the summer, hopefully, so that we're prepared for the fall. So these are all really important questions that the team is working on.
When we look around at other provinces who feel that, they're kind of already entering this new phase, almost of endemic response, is British Columbia an outlier? How long do you see this transition we're undergoing right now to last?
I don't actually think we're an outlier in any way. The measures that we took were not the same as some other provinces. We're right on track. We've removed all of our capacity limits and things like that, for example, on a number of different settings. So there are a couple of fundamental pieces that we still have in place, and we've been looking, for example, for mask mandates, and we've been looking at what are the natural transition times and what amount of transmission in our community means that these additional barriers are not as needed as they are when we have high rates of transmission. One of the really important natural breaks that we're seeing and is looking really optimistic is spring break for K-12, and that starts on March 14th. So I think across the country we're quite aligned on having some basic things in place. Different provinces and territories have used things like their vaccine card spread in different ways. It is an important tool that is still having really important effects and is in play here in BC still. But those are all things that are additional layers of protection that as transmission comes down, as our hospitalization comes down and the risk in the communities changes, we can shift more to individualized personal management. And, all of this is aligned with having new vaccines available, the high level of immunity from people stepping up and getting vaccinated in BC, and extra tools like having the at-home tests that people can use to help guide their own actions over the next few months. But really it is preparing us. We are, and we've had this discussion with my colleagues across the country even this morning. We are in a transition phase. We do not yet know enough about this virus from an epidemiologic point of view for us to consider it endemic. That presupposes that we know the patterns that we're going to see through respiratory season. We have a pretty good idea now, but there's still a lot of this virus circulating around the globe, so there are inevitably going to be changes and surprises that we will need to adapt to.
Just to say that I think our approach has been founded on the advice from the Provincial Health Office, from the BC CDC, and has been, I think, compared to other jurisdictions, not just in Canada but around the world, the most consistent approach. That has meant that for children in schools, they've had the most opportunity to be in school of all the jurisdictions because we've taken a consistent approach and have had the remarkable work of not just people in public health, but of teachers, the support of parents and the children themselves. I think our approach has been consistent in while it may not feel this way living in British Columbia all the time where measures change, we've had the most consistent approach to public health measures, and that has led in part, I think, in addition to the contributions of British Columbians, the most significant adherence to public health measures, because it is the adherence that's been the most important thing. People in BC have pitched in, and it's been exceptional. We have some of the highest rates of vaccination in the world. These are parts of our approach, and there are some differences at times between jurisdictions. British Columbia was one of the first with the BC vaccine card, first to implement it. We're the jurisdiction in Canada, or one of the jurisdictions in Canada, one of the largest jurisdiction in Canada that has, and we have benefited from this extraordinarily during this most recent wave of COVID-19. All of our healthcare workers in our facilities vaccinated. So we've been consistent and thoughtful, and I think the response from the public has followed that to a great degree and has supported that. That's something that we've all done together here. This isn't a comment on other jurisdictions. This is what we've done here. We've dealt with this as our pandemic in BC. It's affected regions of British Columbia differently and at different times, but we have, I think, supported one another in an exceptional way. So I'm pretty proud of British Columbia, and we're going to continue to follow that approach as we deal with this next phase of the pandemic, which still, of course, exists and still affects people in our hospitals and our communities.
Next question comes from Binder Sajan, CTV News.
Hi, Dr. Henry. I just wanted to clarify something that I thought I heard you say, which was that there could be additional precautions this spring. I know you're talking about lifting restrictions, so I was a bit confused about that. Could you just let me know what you were saying there a little bit earlier?
No, I was talking about the layers of protection, and as we have decreasing risk, that they're no longer needed, but that we need to pay attention to next fall. Because
we know there will be respiratory virus resurgence, and we've seen that there's a pattern to COVID as well. So we may need these additional layers of protection again as we move into next fall. So if I said spring, that was a mistake. I'm talking about next fall and winter.
I do, thank you. And at least I know kind of touched on this too, but what I'm hearing, and I'm sure you hear it too, from people is they look at other provinces who are, lifting mask mandates, vaccine mandates, et cetera, and say, what's different about BC here? And I know we've talked about, and we've heard you talk about how the restrictions have just been generally different. But can you tell us in terms of like the science, is it science? Is it politics? Like, why are things a little bit different here in BC?
Yeah, it's probably
Yeah, it's probably everything about that. It's how we have used what we've done. And I think if you look at actually what is happening in provinces and you put it down and you look at dates and you look at what's happening where and what restrictions are in place, we're all very much aligned. So things that are announced that are happening at a time in the future, it's a way that some people have been working through this. And, what we've done is given a timeline for when we're revising things. We've had the layers of protection in place in the settings where they're most at risk. And, if we look at the BC vaccine card and where we've used the BC vaccine card, it has been focusing absolutely on those highest risk indoor settings in discretionary settings. And so it has a really important role in helping build confidence going back into those settings as we've come through this wave. And we know that it does reduce risk to have only vaccinated people, because we know that over 60% now of people who are vaccinated have had their booster dose, and that reduces risk of transmission. So yes, we are following the process that we've been using, and that is slightly different than how other provinces have used their vaccine cards. So it's all the same science. It's how it's been implemented and where we've been using things, what restrictions are in place, when and where, that have varied a little bit between provinces.
Coming back to Minister Dix.
Just to say, I think what's the same in BC is the same approach, following what we see in the pandemic here in BC, led on the epidemiological side by public health. And of course, so it's reasonable to ask what's different about BC. One might reasonably ask what's different about other provinces. I don't know if that's the important question. I think people generally are going in the same direction. But what's been different about BC and what's remarkable about BC, I think, is the outcomes, which generally have been very good here compared to any other jurisdiction in North America. First of all, just let the bell ring. The outcomes have been very good, and I think our response has been consistent. So it's not a race of a few days. I think one province just announced changes today. And so we're going to continue to follow the same approach, and I think that's what people in BC want. They want, we've had, in many cases, relatively fewer measures, more consistency of measures. And so whether it happens one day or 1 week in one province and one day and 1 week in another province isn't the important question. I think the overall approach continues to be the same, continues to be led by the response to the pandemic and the need to support public health. And I'd say this one thing finally. While we have less than half of what we had people in hospital that we had with COVID-19 at the height of this wave, we've still got a significant number of people in hospital. We still have people affected in our healthcare system, as you see in the numbers. So we continue to have to be cautious, and that's why you see a thoughtful, balanced approach that has been, I think, supported by public health from the beginning here, and you're going to continue to see it.
Next question goes to Richard Zussman, Global News.
Henry, I'm sure people will get the impression listening to you today that by spring break we will have at least the mask mandate and the vaccine card potentially eased. Would there still be support from the province when these changes come in place for different businesses or retailers to keep those things in place? Or will the guidance be when they're gone, they are gone, no matter what?
Yeah, so I will say we are talking with all of the involved stakeholders. There's a whole lot of things that go on behind the scenes of how we make those decisions about timing and what happens where. But you raise a really good point, and I've tried to say this a number of times. We're moving to a transition where people have to make those decisions for themselves around what are the important things you need to do. We know that there are people in our workplaces, people in our social networks who are immune compromised, who are older, who we want to spend time with, where we know the vaccines don't work as well, their immune systems are. We may not even be aware of those people. So yes, we all need to continue to be respectful We need to have it a mask-positive environment. We know that it makes a difference, and particularly as we are continuing to see transmission in the community, it will make an important difference for some people to continue to do that. And we all need to respect that and support that, particularly in schools and in some of the other indoor environments. So I absolutely will support businesses continuing to protect their workers, making sure that depending on what the business is and the risk, that they can continue to use the BC vaccine card. It is an important tool that helps people in different situations. That masking will still be supported in many of those indoor environments where we know it is riskier, and it will be different in different communities. And I will also say that these are not tools that we abandon. They are things that helped us, that worked. They're part of the strategies that we've had. Before we had vaccination, they were the only strategies we had. Now we have that level of immunity, but that's going to change and wane over time. And there's still many things we don't know about this virus and how it's going to change. So we need to keep those in our back pocket for those times when we might need to use them again.
I know spring break is a very natural transition point, as you alluded to. Is there any pressure on changing the rules because we may have an influx in BC from people from other jurisdictions where they will no longer have mask mandates or vaccine cards? Like, by spring break, when people move around, is that being factored at all, that we'd like to have sort of a universal set of policies across the country?
Actually, hadn't thought about that. If you think about it right now, Saskatchewan, as my colleague in Saskatchewan reminded us this morning, spring comes early in Saskatchewan, so they're on their spring break right now, as are Quebec. And we've known that in the last couple of years that we get a lot of people who come to BC at this period of time. So no, the measures that are in place in BC are in place because of the transmission and the data that we're seeing in our province. And we expect that if people come here, whether it's going to Whistler, or going to Big White, or coming to Vancouver, that they follow the rules that we have in place in the province here. But I also know that a lot of people are looking at this last 2 years has been difficult, and they want to have that break. And many people will be traveling. And so these are times, a natural transition time, and really important for all of us who have been thinking about these for the last, in some detail, is trying to give a sense of normalcy to schools for the end of the year. So we are working really closely with the school, the K-12, but also the early childhood educators in our childcare sector and post-secondary to see, what can we do to relieve that pressure on young people in school settings particularly.
Dr. Henry, you talked about immunity waning, and so I'm just wondering if you can discuss, how will we know what you've learned from looking, I'm guessing, at Israel, of when we might get a fourth dose of what we have now, or would you wait until there was a new formulation for whatever, as you said, may be coming down the line?
Yeah, lots of questions, and I think those are questions that we're all asking around the world. Yes, we've watched what's going on in Israel. We've watched Ontario has given a fourth dose to some people in their long-term care. But we're also all have slightly different programs. We went very early in BC to the extended interval between dose 1 and dose 2, and we kept with the 6 months for the booster dose, even in our long-term care homes, and that has proven very effective at giving stronger, longer-lasting immunity. So we are watching and will continue to look at things like breakthrough infections, who's being affected, how severe illness is happening, and monitoring the changes in the virus, and the whole genome sequencing is a big part of that. So yes, it will be a matter of timing and a matter of who. So there are many different scenarios that we could face. We could face a very different virus for which everybody that has immune escape, which means that we're all, again, susceptible, in which case we would need a booster dose for the broad population. The other scenarios that we could face, and we've been thinking through this, is a different virus that has more impact on older people, in which case only a target group of people might need a booster dose, and that might be in the fall next year. So there's lots of different unknowns. I think I'm trying to say that. I do think it's very likely we're going to need a fourth dose, a booster dose for people who are most at risk, and that's our elders and seniors in long-term care. It likely won't be in the next few weeks to months, but those are questions that we're working through. Perfect answer.
It answered a lot. And I don't know if this next one is for Minister Dix or for you, Dr. Henry, but you eased restrictions a bit, allowing dancing and whatnot, and we've seen some videos of places over the weekend where, it looked like a party like we'd had before the pandemic. Masks off, people dancing, people milling around. And I'm just wondering, is there any more, are there any more fines being given out? Are bylaw officers still going out? Or are we sort of throwing our hands up and saying, we're going in that direction, so things will be what they'll be?
I think we are.
I think we are trying to shift to personal responsibility and business responsibilities. It still is an important thing for people who work in those settings to make sure that they're protected, and that's why we have things. We've done things in a sequential way. We have the immunization rates that are very high. We know that makes a difference. It reduces risk substantially. That's why the BC vaccine card is still in play in those places. So that mitigates the risk that we're seeing. I just think it's time that we do come together. It's important for us to experience those things that we haven't for a long time, particularly for younger people. And yes, we do ask you to wear masks, but I realize that for owners and operators of these businesses, sometimes that can be challenging. And so we're supporting them and helping to do that in a way that's non-punitive.
But just to say, the BC vaccine card and the mask requirements that exist are provincial health orders. They continue to be. It doesn't mean they're enforced in every circumstances. Obviously, that would be important and maybe not even desirable. But they're the law. They're what we need to do right now. And I think it's really important and has been really important to stay in the moment in the pandemic. We've had, as a result of most recent announcement of the relaxation of restrictions, a lot more activity. All of us, I think, are done, or many of us in any event, have done things that we hadn't done at previous moments in the pandemic. And I think that is both expected and positive. But the rules that are in place continue to be the rules. They're in place for good reason, and people need to follow and support those rules, and overwhelmingly they are.
Next question goes to Cole Schisler, Black Press.
Hi, thanks for taking my question. Last week, I had asked you about accessing the post-COVID-19 care clinics here in BC, and you had said that a serology test is an acceptable test to get access to that care. Serology tests cost $75 through Life Labs, and I was just wondering, why aren't serology tests covered by MSP?
Well, I can say it depends on the situation. So serology tests are covered if they're ordered by a clinician. So it's all part of that process as far as I'm aware. So the people who are being referred to that clinic where the clinician believes that that's an important test for them to have, it is covered by MSP. And the minister can correct me if I'm wrong on that.
Over to Minister Dix.
That's right. Medically necessary care is covered in BC. I think the concern that had been expressed at a time when, relative to the number of people with COVID, there was less PCR test positive cases, and that's certainly been the case since the end of December, the concern that people wouldn't have access to care. Well, they're going to have access to care. People with long COVID or ongoing symptoms from their COVID-19 transmission are covered for medically necessary care in BC, and that'll continue to be the case. It's not for that test or any other test a la carte in that sense. You don't get to go in and do that. But as Dr. Henry has said, when advised by a clinician, it is the case.
Cole, do you have a follow-up?
Yeah, and thank you for that response. I'm sure that a lot of people will be relieved to hear that. The next question is about how prepared is BC if we get another variant surge. We're hearing from nurses and healthcare workers talking about being burnt out. People are leaving the industry. A lot of people are expressing fatigue about COVID measures, and I'm sure, we're all very tired of it at this point. But if we ease up restrictions and then BC gets slammed by another surge of cases, how resilient is BC going to be in the face of that next wave if it comes?
I think that is the question that all of us are thinking about globally. There are a lot of around the world. We're all being faced with the changes that we have no control over, and this virus does that. That's how viruses work. What we do know more about being able to detect them, being able to find the changes, and being able to assess the impacts. And I was talking a little bit in the answer to other questions earlier. There are many different scenarios that we can see in the future. Some of them would be more severe illness. Some of them will be more transmissible, less severe. It's how well a virus can escape the immune protection we have through vaccination, which is proving to be relatively robust, which is the good news, especially against severe illness. So the answer really is we don't know what's going to happen next, and we need to find some way of finding some breathing room for our healthcare system, our healthcare workers, and for everybody else who's been tired through all this. So that's why we're taking things slow right now, so that we can relieve that pressure in a measured way and be prepared for what's coming next. We're also spending a lot of time looking at, and I'll turn it over to the Minister about this, looking at how do we bolster our health human resources in particular. We have lost people because of being tired and being burnt out, being sick. So how do we support people coming into the healthcare system so that we are more resilient and more robust? We've seen there's weaknesses in our care system that we need to address.
I think there's 2 points. The first is that there are exceptional challenges continuing to face our healthcare systems. Why we announced 602 new nurse training positions last week. Why we've added more than 6,000 people to the seniors care sector with the program that we announced in September of 2020. The HCAP program and others that have supported long-term care. So the health human resources question is a central question, and we'll be presenting a plan on that shortly that builds on the work that we're doing, but it is significant. I just want to also remind people that there's all of the effort that's part of surgical renewal. We have, because of the work of healthcare workers, fewer people on waiting lists for surgery. Doesn't mean there are not a lot of people waiting a long time for surgeries, but fewer than there were at the beginning of the pandemic, which is an achievement of our healthcare system. But finally, I'd just like to note there's another public health emergency that profoundly affects healthcare workers, but mostly communities and people in every part of BC, the overdose public health emergency. And so on all of these efforts and more, the healthcare system, as I would expect, have as busy a year in 2022 as 2021, and it reminds us of why we need to take the steps, we continue to take the steps and continue to live in the present with respect to the COVID-19 pandemic, because there are many other challenges, people in need of care, and we need to provide them with support. And so those efforts are going to continue, and they're a significant focus. In some ways, the challenges of this year are just as significant as they were in 2021 and 2020. They'll be somewhat different. But you're quite right. Our healthcare workers, our nurses, our health sciences professionals, our care aides, the people who put food on the table in our healthcare facilities, all of those people, and of course our doctors and many more, all of them have been affected by this, and we need to support them, understanding that this is going to be an exceptionally busy year for healthcare.
We have time for one more question today. We go to Belle Puri, CBC.
Have our answers in English and French, please. Dr. Henry, an update, please. How many cases of the BA2 variant have been detected in BC? And, I'm just wondering, you've talked about how to be prepared for another wave, but what are your concerns about this variant given what's happening in other parts of the world?
So I actually don't.
I actually don't have the numbers, but I can get them for you. I know we've been following it. It's been different in different parts of the province, so it has been increasing, but slowly, the BA.2 in BC. And I think what we are learning and what I'm hearing from my lab colleagues really is that it's around timing of when it was introduced. So we're not seeing it rapidly take over. I have obviously been watching really carefully about what we know about BA.2. There's also a BA.3, and there's a number of others as well. We haven't seen any of the .3 in BC yet. So it does seem to be more transmissible, and that may be the reason that we're seeing certain pockets around BC having more cases than other places. But it does not seem to cause more severe illness or to have more ability to evade the immune system. So those are things we're watching carefully. Yes, these are all concerns that we have, and it's going to be the thing we're not looking for, as what happened with Omicron, that suddenly is going to appear. So we need to be prepared for all of it. I will say the one other one that we're watching carefully is that there's been Delta Omicron variants that have been found in Australia, in the UK, in small clusters and a few other places. We have not yet seen any of that in British Columbia, but our whole genome sequencing again can detect that variant as well.
Oui, le Dr Henry n'avait pas les chiffres particuliers, mais on va les donner avant la fin de la journée. Ce qu'on a, on va continuer à faire nos recherches et nos tests sur les génomiques de la pandémie, et ça va continuer. Il semble que le BA.2 a des qualités peut-être plus transmissibles, et c'est pourquoi cette variant est trouvé particulièrement dans certaines communautés, mais aussi il ne semble pas que ce soit plus sévère que l'Omicron en général. Donc, il y a aussi une variante qui combine en quelque sorte, c'est une combinaison en quelque sorte du variant Delta et Omicron. Et on a vu cela, par exemple, en Australie, mais on n'a pas encore vu cela en Colombie-Britannique.
Belle, do you have a follow-up?
I do, please, for Minister Dix in English and French, please. You talked about the millions of rapid tests that are going to come to British Columbia over the next 3 to 4 weeks. So I'm wondering how soon will people younger than 70 be able to pick them up at pharmacies? And that number you gave us about how many people over 70 have collected their rapid tests, is it starting to plateau? Could tests that were put aside for them now be given to people in other age groups?
Okay, about 70,000 seniors, more or less, have picked up their rapid tests, those over 70. And remember, in some communities that started on Monday, and in a number it started on Friday, so that's just starting. But we're going to work our way through the age groups, I think, fairly quickly. And so we're going to give an opportunity in the next few days for those over 70 to get access to their rapid tests. And we're going to move our way fairly quickly down the age groups. So I would expect that to happen in the coming days, and that will be announced on various government websites, and we'll let you know, and social media platforms as well. And we'll let people know through you and members of the media and communities when that's going to happen. And then we're just going to work our way through. Many young people, of course, and parents have access to those tests because of the large distribution in K-12 and post-secondary education already. So you see that in those parts of the community. And so we're going to be working our way through 65, 60, 55, et cetera, in the coming weeks in a similar way to what we did in vaccinations. Je dirais en français que...
Yep. All right, Dr. Bonnie Henry and Health Minister Adrian Dix providing BC's pandemic update. Dr. Bonnie Henry says we are seeing encouraging trends. The numbers are going down, but we are still seeing widespread transmission across the province, and we still have a significant number of people in hospital. In terms of lifting restrictions, we will likely see some easing of restrictions as we approach spring break. Some good news there. And she says we will likely not need those extra layers of protection in the months ahead.
Donc, les gens qui ont 50 ans, etc., 50 à 60 ans après cela. Donc, cela va marcher un peu comme on a fait avec la vaccination et je pense que ça va aller vite. Il faut forcer de reconnaître que beaucoup de gens qui sont plus jeunes que cela, surtout dans nos écoles, du kindergarten